Before we start any bones and bone markings, we really have to know your anatomical terms and your directional terms. So first of all, everybody know what the anatomical position is.
Oh. Yes.
Yeah.
So when we're looking at the anatomical position, I don't remember going through this with you, so we had to kind of really look at this. Like, imagine this picture on top. This patient is the front of him. Here's his eyes or her eyes and mouth, right? So this is anterior. So if you're looking anterior, you're looking at the anterior view. So he owns or she owns the anatomy. So this is the right side. This is the left side. And this is an anatomical position because look, the thumbs are pointing outward. See? And the palms are face up. So anatomical position, thumbs outward, which is going to be called lateral on both sides, and palms up, which means supinated. So your thumbs are lateral and your palms are supinated, face up. And the toes could be pointed downward a little bit, but for the most part, you're looking at anterior. So there's the anterior knee, the anterior palm or front side of the hand, supinated, anterior left shoulder, anterior right shoulder. Okay? So that's really important that you know the anatomical position. So proximal is closer to the body. Like this is the proximal humerus. This is the distal humerus. So the palm is distal to the shoulder. The shoulder is proximal to the elbow. So getting closer to the body is proximal to the midline. Sometimes it has to do with the midline. Sometimes it just has to do with the body. So later on, we'll play a little game where I'll say one thing and you'll say the opposite. Like I'll say distal, you say proximal. I say deep, you say superficial. Okay? So superficial versus deep. Superficial is more external, like the skin, the integument is external or superficial to the muscles. And the hypodermis is deep to the epidermis. Or the heart is deep to the sternum. And you could say the sternum is superficial to the heart. So it doesn't have to be the complete outside. It depends on what you're looking at. Like when you talk about gross anatomy, which is now what we're going to do more of, gross anatomy. That's what you could see with the eye, naked eye. And then microscopic anatomy is what we did with histology, looking at slides, right? Microscope slides. All we did on the last exam was the microscopic anatomy. So we could even go that far. Like the epidermis was microscopic, right? We looked at that the stratum basal was deep to the stratum granulosum. The dermis was deep to the epidermis. And the stratum corneum was superficial to the stratum spinosum. Or even the stratum spinosum was superficial to the stratum basal. So that kind of keeps that in line there. Let me get this back. So also you have superior and inferior. So superior is also called cranial. So the cranium is the skull. And basically the bottom, because we're mammals, right? So we have a tailbone, but we walk on two legs. We're bipeds. So technically below is caudal, and that means tail. But you could say inferior. Inferior is a better word. So the foot is inferior to the hip. Or the stomach is inferior to the heart. So the opposite of superior is inferior. And the jaw is superior to the hyoid bone, which is part of the neck. or the jaw is superior to the sternum. Because you're going to have to know names like superior orbital, inferior orbital, a lot of things, a lot of markings on the skull. So that's really important. And anterior and posterior probably mentioned, like anterior is the front, but it's also known as ventral. So if I say ventral, you say dorsal, opposite. If I say anterior, you say posterior. So we use anterior and posterior more. Like anterior is the front view, like the guy in the anatomical position. Posterior is the back. So again, we're bipeds, so we're standing upright, so we could say anterior and posterior. But if this was a quadruped, like a cow or a sheep or a dog, then their belly would be ventral, and their back would be the dorsal, like a mammal, like other mammals, like a dolphin or a porpoise. They have a dorsal fin on their back. Ventral would be their belly side. So it's kind of similar for us, but we say anterior, posterior. And then medial is towards the midline, like the shoulder is lateral to the sternum, whereas the sternum is medial to the shoulder. And sometimes we use it in between, like middle or intermediate. And you'll see when we look at certain bones, you have to say like middle phalange or intermediate cuneiform, which is one of the tarsals in the foot. So something could be in between, like if there's three things, like you'll see, we'll call it middle, like you have the distal phalange, the middle phalange, and the proximal. So that's another term. We did distal and proximal. So this is like, if this was your pinky finger, this would be the distal phalange. We'll do that next week, but just so you have an idea, this would be the middle phalange. And then you'd have the proximal phalange. And proximal will be towards your metacarpals, which is your hand. And then you'd have carpals, which would be your wrist bones. And then you have your ulna, because the ulna is medial on the pinky side. So you have different flow. So you have your further away, if you look at your pinky, it's a tiny little bone. It's a long bone too. Distal phalange, middle phalange, proximal phalange, fifth, and this is the fifth digit if I'm talking about the pinky. So this would be your fifth metacarpal, and then you'd have an articulation with the forearm bone called the ulna. So you know the flow from distal to proximal. And then, of course, you have to know the names. And then the bone markings, which are usually a hole or a crest or some place on a bone that a muscle attaches to. Yeah, so that's a lot of stuff. So where are you in lecture right now? You probably either finishing up muscle or you've finished muscle, correct? Anybody help me out with that?
Muscle. Yes, we finished muscle.
Finished muscle tissue. So we're not going to do the muscles for a couple of labs, but in lab, we're just learning the names of the muscles and where they attach. So they attach to bones, right, via tendons. So we'll look at the markings of the bones or where the muscles attach sometimes, or we're going to look at holes. And the holes is probably the hardest part of this whole lab, is looking at the skull holes. And most of them are called foramen. So we have to go through that. That's about nerves and blood vessels traveling through in the skull to go to other places. Okay? Just give me 1 second, please. Sorry. Sorry about that. So let's get into the axial skeleton. Now, the PowerPoint I have up here, and I'll show it to you. I'll share it with you. This PowerPoint is for both labs, both bone labs. So we'll do all the axial part today, and you'll see what axial means. I'll do a slideshow so we get nice thin writing. Let's see how that looks. So this will work for both labs. We'll do up to the vertebrae today, maybe a little bit of the os coxo, which is the pelvic bones. And we'll take it from there, okay? So the difference between appendicular, just the words, axial is along the long axis of the body, like down the middle, like the skull to the vertebrae. and the ribs too. Appendicular means appendages, like your arms and legs are involved, so the joints of your arms and legs. Now you did joints, so you have an idea of the parts of the shoulder joint, of the knee joint, the hip joint, the elbow joint, ankle joint, and other joints. So today we're not going to talk a lot about joints except for the sutures in the skull, which is really easy, but just a lot of memorization. So appendicular we'll do next time. So it's a long axis of the body down the middle. So it includes the skull, the vertebral column, like I said, and the thoracic cage, which is the sternum, the costocartilage, and the ribs. And then we'll do the appendicular skeleton. So this is the axial skeleton right here. You can see what's in blue. So it doesn't include the scapula. It does not include the humerus, does not include the scapula. So it has the skull and the facial bones, which we'll go through, and then all the vertebral bones all the way down to the coccyx. And then the ribs, which is the thoracic basket or thoracic cage, the costocartilage, which connects the ribs to the sternum, and the hyoid bone. There's a hyoid bone right in front of the neck. Can't see it here. So this gives you the numbers. I'm not going to ask you for the numbers, but it's good to remember them because it helps you count and make sure you see all the different vertebrae. So here's some of the words we're going to use. Now you don't have to like memorize this now, but as we go into the bones, you have to know these markings, like articular surfaces, depressions, projections off bones, and then the holes. So today we're going to talk a lot about the foramen and fissures. So a fissure is like a slit-like hole. A canal is a little thicker and denser, cave almost. And a meatus is even thicker than that. And then we don't see a lot of sinuses, but that'll show up once or twice. But a lot of foramen. Foramen is a big word. A few canals, fissures in the eye socket, and just a couple of meatus. So foramen is where you're going to live. So that's really important. Today we will talk about some crests, which is like a mountain range, a line, a process, ramus, which you'll see. And again, you don't have to memorize all these now, but when I go through it, it'll make sense. And this in trochanter, tubercle, and tuberosity, they're kind of difficult, but that is more appendicular. Like trochanter is on the femur, tubercle is on the humerus, tuberosity is on different bones because tuberosity is usually where a muscle attaches. So it has this rough projection. And depressions are fossas. You'll see fossas. You're only going to see alveolus in one place. And sulcus, you'll see a bit. Fossas will probably be a big one today. And of course, next time. And some specialized things like trochlea. So you should know all the bones. I'm not going to ask you like what's a flat bone, what's a long bone, but you should know that these are long bones, the bones that have the diaphysis, which is a shaft, and two proximal and distal epiphysis. So that's a typical long bone, like the femur is the longest bone. And the humerus is a long bone too, with a proximal epiphysis and a distal epiphysis and the shaft, which is diaphysis. And even that little pinky toe or finger, the distal phalange is actually a long bone. So, but I won't really ask you that because you did that in lecture. So today we're going to live in the skull. There's a lot of things. Cranial bones, not too bad. Facial bones are separate, which you'll see. And I'll go through each one of those before you go into your lab, which you're going to live in APR and the Atlas, because that's where all the questions are coming from. And it's a great learning tool because you're not in lab looking at the actual bones. So we'll see the cranium, and the cranium basically are the bones that protect the brain. And we'll go through the cranial bones. You don't have to know what calvaria means, just cranial bones. And the facial bones are basically muscle attachment, structure of the face, cheekbones, zygomatic, the mandible, which is your jawbone. And there's a few of those. And we'll go through all of these. You'll have to know all these names like zygomatic, lacrimal. Like lacrimal, I'll tell you right now, means tears, like crying tears, not tears. Nasal bones. I'll go into what concha is. Your palate. Maxilla is above your mouth. Vomer, mandible, all facial bones. And we'll look at the cavities. Obviously, this helps you also if you look at the skeleton in like anatomical position. You should always think of anatomical position. You can see the orbits are anterior. That's where the eyes are, and the nasal cavity is anterior, and you can see the teeth. So that's anterior. Sometimes you could see inside of the bone. You have what's called sinuses or cavities within the bones. So long bones, flat bones, you're going to see irregular bones, short bones throughout the next two labs. So you should remember some of that. This is just, I would never show you this view, but this is just if we cut the face off on the front of the facial bones and one cranial bone, you could see you have your cranial cavity where the brain is, right? The brain is in here, which has two lobes, the cerebrum, and then here's where your eye is in the orbit. Then you have the nasal cavity, right here where you put your glasses, and then the oral cavity where you have the teeth, right, through here. And the jawbone is the mandible here. The top of the mouth is called maxilla, which you'll see. But repetition is really good. So let's get to it. Let's look at the skull. So this is anterior view. First thing and foremost, we're not doing appendages, so the anatomical position doesn't really come into play so much. But this is your anterior skull with the mandible articulated. So you have the mandible is there. So the first thing you see is this one unpaired bone, and a lot of bones are paired, you're going to see. This is all frontal bone. So this is one of the cranial bones, frontal bone. Now you can't really see this, the lateral view, but you could kind of pick up a bone here and a bone here, which is a paired bone called the parietal bones. So this is the right parietal bone. Remember, this is his right or her right. This is their left. They own the anatomy, not you. So you could see another cranial bone called the temporal bone right here. Temporal bone. And that's pretty big. There's a lot of parts and markings to the temporal bone. Where frontal is just pretty much straight up. Big glabella, which is the brow. I won't ask you that. You just have to know this is all frontal bone. And then there's a tiny little, if you look in here, you can see it. I'll show you later. From the lateral view, you have the sphenoid bone. So that's another cranial bone. So far we have frontal bone, which is only one. We have parietal, which you're going to see more from the lateral and the superior view. There's two of those. And then you have temporal, which are two. Okay. And then the sphenoid technically is one bone. It's really one bone when you look at it, but it has left and right. So sphenoid, you'll see later, is a deep bone that comes from inside the skull. And then there's another bone called the ethmoid bone, which I'll show you later. That's much more difficult, much more deep. It has a lot to do with where your sense of smell receptors are, your olfactory receptors, ethmoid. The lacrimal bone is where you have a duct and a foramen for tears as they run across your eye and go down into the lacrimal duct. So we'll look at that in a different view. And then that's pretty much, except for the one in the back, which you can't see, the occipital bone, but that's posterior. You can't see that. Occipital is in the back. And there's only one of those. Occipital bone is a cranial bone, but there's only one. And then in between these cranial bones, you're going to have sutures. So we'll look at different views and see the sutures. These are facial bones now. Like right here is your zygomatic bone, which is your cheekbone. All of this is above your mouth on the skull, below the nasal cavity, and this is all maxilla. And notice the holes, which we'll talk about later. There's even holes up here, foramen. And in here you have a fissure, just to tell you where we're going with this. So you have to know inferior and superior. And here's the jaw. This is all mandible. All mandible. Technically, it's a separate bone. It forms a joint with the temporal bone, and that's why they call that the temporomandibular joint. Okay, so again, you really need your point of view. This is a anterior view of the skull and facial bones, or the cranial bones and the facial bones of the skull. Better way to say it. This is a superior view. So let's just play the game for a second. And you got to put your mics on. You don't have to put your cameras on if you don't want to. You can. It really helps, believe it or not. But I'm going to tell you a directional term, and you're going to give me the opposite. So if I say anterior, you say what?
Posterior.
Excellent, excellent. If I say deep, you say
Superficial.
superficial. There you go, Rosalind. That's a tough one. If I say proximal, you say
Distal.
Distal.
beautiful. If I say medial, you say
Lateral.
Sagittal.
lateral.
Lateral.
Or I'm sorry.
Sagittal.
If I say, no, that's sagittal. Although that's a really good view.
Mid sagittal.
Yeah, mid sagittal is a plane. Like mid sagittal is a plane. That's a really good point. So if I'm looking at a sagittal view, technically that's a lateral view, right? And I'll show you that. That's a really good point she makes. Okay, so excellent. Excellent. So always go through what's the opposite, and that'll help you. Oh, and you'll never forget that. You'll never forget those particular directional terms. So let's get back, see if I can get back to the slideshow. Excellent. So this is a superior view. Now you really got to watch this, because if you notice the skull in the back, this is a superior view of the skull. I'm looking at it from the top. So the opposite of superior is inferior view. So this is, oops, sorry. So this is the back, posterior. So this is the posterior part of the skull in the superior view. This is the anterior. And sometimes it's not so easy because, again, you have colors here. Like I could see the frontal bone, and it says frontal bone, and it's a different color, but it's not always like that. Then I'll highlight it through, when you do your A&P revealed through McGraw-Hill, you'll be able to highlight all these bones. But look at the way it kind of tapers to the front. Do you see that? It's kind of thinner in the front. And you can see this arch here, this zygomatic arch. You can see over here. So that kind of gives it away. So here's a bone we haven't seen yet. And this is posterior, and it's the occipital bone. So now I'm going to show you 3 of the 4 sutures that connect these bones. Now in a fetus, these aren't fused. So you have to look at the fetal skull later, and you can see that there's spaces between these bones. But this is an adult skull, or a late childhood skull, and you can see that there's a suture between the frontal bone, and these are the parietal bones. So this is the left, and this is the right, because now I got my direction down, because I know this is a superior view. This is anterior, and this is posterior. So this has to be left and right. So if I put an X here, right here on the practical, or highlight this whole bone, that's your right parietal bone. So the suture that separates the frontal bone from the parietal bones is called coronal suture. Coronal is like a crown. Like if you're looking at it from the anterior view, you can see it on top like a crown. And then there's a suture that separates the 2 parietal bones, and that's called sagittal suture. And it is mid-sagittal, like Marissa said, it's mid-sagittal. But it's only separating the parietal bones. In a fetus, you may get a separation between the frontal bones, but this is not a fetus. This is a full-grown or very older adolescent. Okay? Now, occipital bone is posterior. It takes up the whole back of the skull. So there's a suture that separates the parietal bones from the occipital bone, and that's called lambdoid. Lambdoid is kind of a weird word. So know the sutures, and we'll look at them from different views. Really important. So right away, know your point of view. So now we have a posterior view. Posterior view, we're looking at the back of the skull. So again, the spine, not again, but the cervical spinal column has been removed. So all this is a skull. So you can see the back of the mandible. This is posterior mandible, like inside your mouth. So if you're looking at this, Now you have to know that this is right and this is left because this is a posterior view. So you have your big parietal bones, and then you have your occipital bone. And you should know that the frontal bone, the two parietal bones, the occipital bone, sorry, and the temporal bones basically are protecting the lobes of the cerebrum, like the frontal lobe of the cerebrum, brain, the parietal lobes of the cerebrum, the occipital lobes, there's only one occipital lobe of the cerebrum, and the temporal lobes of the cerebrum. So they all protect those areas of the brain, which you're going to learn later. So here's an excellent view of the lambdoid suture. And this is all occipital bone. Now there's a part of it, this is temporal bone right here. This is temporal bone from the side. You see that really good from the lateral view, which we haven't seen yet. But you can feel this process on both sides with your hands right now on your skull. You could feel that there's like a little bump under your ear, like inferior and posterior to your ear. And what that is called, and we ask this a lot, this is the mastoid process of the temporal bone. It's on both sides too. It's here too. So that's temporal bone. It's not occipital. Occipital has a protuberance, which we call the EOP, the external occipital protuberance. And you can feel that too. That's a pretty good landmark on the back of your skull. Sometimes it's really big on people. Sometimes it's not so big. And it's a point of attachment for a muscle like the trapezius muscle, which you'll learn later, which runs like in a trapezoid design down to your shoulders and the middle of your back. So here's your lambdoid suture again. All right. I'm not going to ask you about sutural bone, so don't worry about that. Just know the bones, first of all. Now here's your lateral view. This is the right lateral view. Now it's not mid-sagittal because we're looking at the superficial skull, right? Now if we cut it in half on a mid-sagittal line, then we'd be looking at the deep skull or deep brain, which once you get to the brain and other parts, you'll have that down. So let's go with what we know. We see the frontal bone, all of this. Here's the coronal suture, separating the frontal bone from the two parietal bones. So this is your right parietal bone right here. This is all right side. Here's a piece of your occipital bone and the lambdoid suture. Right? You can't see the sagittal suture because this is a lateral view, superficial. So here's the bones we have to see on the lateral. All of this yellow, all of this, even this here, part of this arch, all of this is temporal bone. And we have to stay in the temporal bone because there's a lot of parts to the temporal bone. And this is the last suture you need to know. You've learned the coronal suture. You learned the sagittal suture. You learned the lambdoid suture. Now we have the squamous suture, which separates the temporal bone from the parietal bone, from the occipital bone, and from this bone right here, which is the sphenoid bone, this purple sphenoid bone. And that happens to be a part of the sphenoid bone called the greater wing, because technically the sphenoid bone is one bone. So this is the squamosal suture, and that's the one you have to know in conjunction with the others. Now, this is kind of important. Now, it says the squamous part of the temporal bone. That means it's the flat part, because technically most of the temporal bone is a flat bone. And then it has a thick part with all these other parts in here, and this is called the petrous, the thick part, petrous, or petrous temporal bone. So it's all temporal bone though. So here's some really important parts you need to know. Let's get this over with now so you have a repetition. So here's that part we saw from the posterior called the mastoid process of temporal bone. And then anterior to that, you have a pointy styloid process of temporal bone. Then there's a hole, which I'm going to ask you a lot about on the exam, is the external acoustic meatus. Now here's like a hole. Now this is a word for, and you're only going to see this here in the skull. Meatus is kind of like a long, thick canal, or a hole through a thick portion like the petrous. So technically you can't call it a canal. And it's external acoustic. You could also say external auditory meatus. And there's going to be an internal one too when we look at the inside of the skull. So, I mean, if you said canal, you'd be correct. But you really should get used to using the word meatus as that landmark. Or it's a hole, but we call it meatus. Not foramen, not canal, meatus, external acoustic meatus. Now, this is a really tough one here. Now, look, this is a facial bone. This is the zygomatic bone right here. That's a cheekbone, which is 2 on each side of your face. But this part right here, and this is what I'm going to ask, and this is the way you have to answer it. This is temporal bone. So you're going to call this the zygomatic process. There's another word, process, which you see a lot in bone markings. Zygomatic process of temporal bone. Yeah, so this is still temporal bone, all of this, but it's called the zygomatic process of the temporal bone. Technically, this little piece here would be the temporal process of the zygomatic bone. So those are your facial bones. Zygomatic is facial, I mean. And here's the maxilla, which is below your nasal cavity above the teeth, and all of this is mandible. Here's your temporal mandibular joint, where the mandible forms an articulation with the temporal bone. And we'll see that connection in other views. Now, if you look into the orbit, you could see, and we'll do this later, but you could see like this is the nasal bone, it's facial bone. And then you have a piece of maxilla. Then you have the lacrimal bone is in green. You know, that's where your tear duct is, or your foramen for the tears to go into your pharynx, which is into your nasal cavity, really. And then there's another bone we're going to call ethmoid, which you could also see through the orbit. So you can see this. The orbit's very difficult, and I'll go through it with you very slowly later. But the takeaway here is, what are the parts of the temporal bone? Mastoid process, external acoustic meatus, styloid process, all part of the petrous portion, the thick part. Then you have the zygomatic process of the temporal bone. And then this is just the squamous section of the temporal bone. And that's about it from the outside. And this is lateral view, right lateral view.
Professor, I have a question, sorry.
Sure, no problem.
So between temporal bone and the zygomatic bone, is there a suture?
Yeah, there is, but we don't have to name that one. It's just to call the temporal zygomatic suture. Excellent question, yeah. So that fuses pretty early, so we don't have to worry about that. Does anybody have any questions? There's a lot of stuff. We can get into a lot more now, though. I'm sorry, what was the question?
Can I see that all the junction between the bones are sutures? Some are big sutures, some are not. But so
yeah, you just have to go through each one.
Okay, thank you.
And go. Let me just show you again, just to repeat. And now I can repeat it. Let me go back, because this is something you really want to. It's going to move pretty fast, so I don't want you to get lost there. So where were we? So lateral view, you can see the sutures, right? I can erase this just so you can see it again. Eraser. So you can see a little more clearly now, right? With all that writing on. And you can see am I not sharing this? Are you seeing this? Yeah, you're seeing this, yeah. So you can see the lateral sutures anyway, like squamous and lambdoid and coronal. And you can't see the sagittal. So you don't have to worry about the little sutures. That was a really good question, because you do see them like show up in other views. This view doesn't really give me much information here. Maybe just shows you what a sinus is. Like, I don't think this is going to help you very much, but this is like a mid-sagittal section of the cranium, and there's like openings or cavities within the bones, And most of these are lined with mucous membranes. You know, when you have congestion, your sinuses get infected or fill up. But there are also resonance chambers for sound. So you have like a frontal sinus. You have a maxillary sinus, which you can't see on this picture. So there are spaces within the bones. That's what sinuses are. Pretty much named after where they are, like in relation to other bones. So now we have to go into a different view, and this is where it gets a little bit difficult. So, and these are really confusing. I'll help you with this because it really is hard to see where you're at. So looking at this picture, you could see it says inferior view. So that when you're studying, of course, look at the inferior view when you're clicking in your atlas or in your APR, it'll show you what you're asking. So this is the inferior view, but this is still the posterior, right? The back of the head, skull. This is anterior because you can see the teeth, right? Which are anterior. And this is all occipital bone. So now you can really see the occipital bone. And all the bone markings like the EOP, external occipital protuberance. Then you have these nuchal lines, superior and inferior nuchal lines. And they're going to be points of muscle attachments below the trapezius for moving the head, turning the head, saying no, saying yes, those kind of things, rotating your head. And hopefully you learned the actions of muscles and joints in the articulations part of your lecture. So the thing that, besides anterior and posterior, the thing that jumps out the most here is this big hole. And that's always a good point of reference on any view, but this is the inferior view. So please stay with me here. And the big hole is pretty much named big hole, foramen magnum. Okay? So now I'm going to go through the holes. So I'm recording this, so at least you have to go back and practice, because once you get this down, you're good. This is the hardest part. So the big hole is the foramen magnum. Then you have holes that are kind of inside the foramen magnum, and that's your hypoglossal canals. So this is a canal. If you said foramen here, I am fine with that. It's hard enough that you can even see where this is. So there's holes that are within the foramen magnum going to other places. So the hypoglossal canal houses the hypoglossal cranial nerve 12. You don't have to know that now, but it's for a nerve, a nerve that's coming from the cranium, from the brainstem, which is within the cranium. So the foramen magnum basically is a hole that separates where the brain, like this, if this is the brain, right? Here's the brain, beautiful drawing, right? This is perfectly drawn. You know, you have all the cerebrum with all the gyri. This is the right side of the brain. This is the temporal lobe. And then you have a brain stem, which consists of 3 parts. And then all of this is in the cranium. So this is the foramen magnum here. And below that is your spinal cord. So brain is in the cranium with the cerebrum, the brain stem, and then below the foramen magnum is where the spinal cord starts. And that goes down between the vertebrae, which you'll see later. So that's good for later. So far, what do we have? We have the foramen magnum and the hypoglossal canal. Now these little slippers on the bottom of the occipital bone are going to be articular surfaces. So these are very important. I always ask these. These are called the occipital condyles. So the first vertebrae, which is called the atlas, is going to articulate with the skull via the occipital condyles. So they're articular processes of the skull. And you'll see the atlas later on when we look at that. In here, we have another foramen, which is not perfectly seen here, but this is the jugular foramen. So of course that's going to house, or an exit point, or an entrance point really, for the jugular vein, or an exit point. It's an exit point because veins drain back to the heart. And it's kind of an oblong hole. It's not very, very circular. So that's the jugular foramen. And then you see, and this is very round right here. This is what's called the carotid canal. So if you look at the two, they're blood vessels too. Like the jugular is only a vein. There's no jugular artery. And veins have like these oblong lumens, openings. The carotid is an artery, which is round, muscular artery. So that's the carotid canal is more round than the jugular foramen. And this is another place where you have to say canal, carotid canal. And please listen to this, because this is kind of important. The carotid canal is only seen on this view, which is inferior. So the superior view, you're not going to see this. And this is the inferior view of the skull, the bottom of the skull, looking up. If you're holding up, like Shakespeare, like Hamlet, and you can see the bottom. So to review, you have your foramen magnum, hypoglossal canal, jugular foramen, and then your carotid canal. So the only one that's unpaired so far is the foramen magnum. Then you go up more anteriorly, and you could see a foramen called the foramen lacerum. It's like a lacerated looking foramen, like a slit, but we still call it foramen lacerum. And it's on both sides. It's on both sides. The next one is a very spiny looking hole, very small, called the foramen spinosum. Another small hole, all housing nerves and sometimes blood vessels. And another one, and this is where it gets hard between these three, you have what's called the foramen ovale. Now the foramen ovale is kind of oval in shape. So that helps you. So I always use foramen ovale. I'll give that a double star as a point of view. And then you could see spinosum. You could see lacerum. You could see carotid canal. You could see jugular foramen, foramen magnum, hypoglossal canal. So you really don't have to know what bones they're in, but you could see the flow. You could see that which one is kind of in the temporal bone and which one is in the sphenoid bone, this blue. This sphenoid looks like a butterfly everywhere pretty much. So we're just going to go through, the sphenoid in a different view. And here's your palate, which you have your palatine bone and your palatine process of maxilla, right? So this is the hard palate. Of course, this is all bone. There's no soft palate here. And there's a foramen right in the middle. There's only one of these. And that's called incisive foramen. So that's right behind your incisors, right? And this is the roof of your mouth. You don't have to know that this is two bones and it's a suture that's fused. Because as you know from the joints, the sutures are immovable joints, right? Fibrous joints, immovable, synarthroses, okay? So that's a lot. There's a lot of foramen. But the first thing you do is make sure you have the point of view, that this is inferior view. Because later on, we're going to look at the bottom of the skull by looking at it from the top, and that's called the superficial view. So go through your checklists and see what foramen you need to know and be able to point those out and make sure you go through MH Connect, you go into APR, and you look at those pictures over and over and test yourself. This is a hard part of this lab. So now this is the superior view. So if I took the skull cap off, right, and now I'm looking down into the skull, right? I'm looking down. So it's like a nut bowl, right? It looks like a bowl. And you have, anterior fossa, which is the frontal bone, middle fossa, and posterior fossa. I won't ask you that. But look, you could see what's anterior just based on the way the skull tapers. And here's a sinus within the frontal bone, the frontal sinus. It's on both sides, though. No sinus in the back. So now let's take a look at the holes again. And let's look at other bony markings within here. One thing you should see here first is make sure you know what bones you're talking about. Like this is all temporal bone, the yellow. This is all purple, is all occipital bone. This peachish, or whatever color this is up top, is frontal bone. The blue is all sphenoid bone. And here's this little part right here, which is reddish, is called the ethmoid bone. Remember your view, superior view. You're looking down into the bottom of the skull. The floor of the skull might be a better way to put it. Okay, so here you look at the big hole. Here it is, the foramen magnum, from the top view, from the superior view. I still have hypoglossal canals. I can see them. They're still in that view. Now I can see the jugular foramen still. Okay, now here's the catch. You do not see the carotid canal from this superior view, this nut bowl view, looking at the floor of the skull. You're going to see a different foramen later on. But here's one you only see from this view as well. And I'm going to ask you this one. Remember the external acoustic meatus? Well, this is the inside of the petrous portion of the temporal bone. So now we're looking at the internal acoustic meatus on both sides. It's paired. So the only foramen that's not paired is the foramen magnum, like I said. Then we move more anterior. You could hardly see it, but there's right below the sphenoid is the foramen lacerum. Here's that little foramen spinosum, sorry. And here's your more obvious oval shape foramen ovale. Crazy, man. So now we have one that you only see from this view, just like the internal acoustic meatus. There's a hole up on the top of the sphenoid called the foramen rotundum. It's still on the floor of the skull, so the exiting nerves will go out the bottom of the skull. Okay, now this is the sphenoid bone right here, and if you look at it, it looks like a butterfly. So these areas right here are called greater wing of sphenoid, which actually you could see between the temporal bone on the lateral. I can't see it from this view. And this is the lesser wing of sphenoid. Now this is really important too. Within the lesser wing of sphenoid, and you can see this from the inside the orbit, you have two holes. And this is for the optic nerve. And this is going to be called your optic canals. So that's a canal. It's kind of long. Okay, so let's review what we have so far as the holes. Foramen magnum, superior view, sorry. Hypoglossal canal. Internal acoustic meatus. Foramen lacerum. Foramen spinosum. Foramen ovale. Foramen rotundum, which you can only seen on superior view. And then you could see the optic canals, which are in the lesser wing of the sphenoid bone. So there's two other things we'll ask on this. Now, if you look up top, I think I'm going to get out of this slideshow because I have to make this bigger for you. So if you look at this close up, you could see the different color there, which is the ethmoid bone. So this is all ethmoid bone, this bone in here. And there's a bump in the middle of it. So the olfactory bulbs are going to be on both sides of this bump, because this is the top of the nasal cavity, technically. So the bump is called the crista galli of ethmoid. The side has little plates with foramina in it, because this is where your sensory neurons for the sense of smell, olfaction, come through to the olfactory bulb. Cranial nerve 1 is the olfactory nerve. So these side areas are called cribriform plates. So the cribriform plate is under the crista galli. It's like a flat area. So the bump is the crista galli of ethmoid bone. That's part of the ethmoid bone, which is another bone of the cranium. And now if you look in the sphenoid, there's the saddle right here. And the saddle is basically going to house the pituitary gland, which comes off of the bottom of the brain. It's a gland, though. It's endocrine. It's not brain tissue. It's endocrine. It secretes hormones. So another name for the pituitary gland is hypophysis. So they call this the hypophyseal fossa, but the saddle is called sella turcica. So if I point right here, if I put a big X through this, you're either going to say hypophyseal fossa or sella turcica, and that means saddle, right? So check your list, make sure you know what those parts are. Your checklist is a big help, just make sure you get through that. So this is the superior view of the floor of the skull. Okay, so this one's a little difficult. I don't think I'm going to go through this one. And the fossa, basically middle, anterior cranial fossa. I'm not going to ask you this, but at least you'll see what's posterior. You can base it on the foramen magnum. And you can practice, going through the holes, the foramen canals. Don't forget the internal acoustic meatus. And the sutures we kind of went through already. So you have an idea of where they are, and go through your list. Make sure you know exactly where you're going with that. And spelling. Right? Sagittal has 2 T's. That's probably the most common word. Even me, I spell it wrong sometimes, but it's got 2 T's. Not 2 G's. So that might mark you right on the practical. Instead of me going back in and have to check that, I won't take off for spelling issue errors on that word. Right? So sutural bones, don't worry about the sutural bones, just know those sutures that I went through. Now the orbit. Let me just stop for a minute, give you a break, give your brains a break. Any questions so far? Yes, no? It's a lot of stuff, right, Rosalind? It's a bit. So, but I think that those foramen and meatus and canals, that's the hardest part of the skull, no doubt about it. Sutures you'll get pretty quick. The cranial bones, the facial bones, you'll get pretty quick. So the foramen, meatus, canals, that's a big deal. But now I'm going to go through the orbit, which is the next harder thing from the foramen, but there's not so much. So let me go through the bones of the orbit, and really good practice in APR. So you can do the lab later or this week and get a good feel for it. And we'll always review, when we go through the bones, because we got to get the muscles eventually too. Okay, so this is the orbit. This is the left orbit. You can see, there's my writing here. Let me see if I can get this written. Go back to writing. Good. So remember the temporal bones here. Here's part of the parietal bone. Here's sphenoid. This is your frontal bone. So I'm going to take the bones from medial to lateral of this left side of the upper face. So this bone right here is a paired bone called the nasal bone. This purple. And that's where you put your glasses. So this is the left nasal bone because there's 2 of them. They are paired. Then this is all maxilla. All this is maxilla below the nasal cavity and up towards the cheek. Maxilla. Maxilla. And then this blue is your lacrimal bone. And there's a hole down here called the lacrimal foramen, which you can't really see that good. There's a lacrimal foramen. So that's kind of an easy one to see, like if you're in the lab, because it's really the only hole in that medial part of the nose. And then you have the greater wing of sphenoid here, and then you have the lesser wing of sphenoid. Now this is really important, that there's a hole in the lesser wing of sphenoid, both sides, and that's the optic canal. So star that one. And you can see it's kind of medial in the orbit, slightly superior within the lesser wing of sphenoid. Sphenoid is all the blue. Here's your zygomatic bone here. And you do get a little bit of ethmoid, not really showing you the ethmoid bone so much in here. So now you have other slits. You have this slit right here, which is called the superior orbital fissure. which is important because you have blood vessels going through those. And this is the inferior orbital fissure. And it looks more of a cross when you see it. So the three holes within the orbit of the optic canal, the superior orbital fissure, which is a slit-like opening, and the inferior orbital fissure. Then you have holes here too, like this is called, not every skull has this actually, but this is called the supra. Supra always means on top, right, or superior. Supra orbital foramen. And this hole right here, and this is all for sensory nerves for the skin. This is the infra, that means below, infra orbital foramen. So again, let's review. Nasal bone, where's that? Here. This is part of the maxilla. The green is lacrimal. Still some maxilla here. This is this greater wing of sphenoid, lesser wing of sphenoid that has the optic canal. The inferior and superior orbital fissures. Zygomatic bone, which is another facial bone. This is all part of the frontal bone. Temporal, sphenoid, parietal. Don't forget the hyoid bone. The hyoid bone is just above the larynx, and you can feel this. It's just a disarticulated bone. It doesn't have any articulations with other bones. It's kind of held together by suspensory ligaments for swallowing. It helps you swallow and maybe chew a little bit. So it basically looks like this from the anterior view, and this is the side. So the only markings on the hyoid bone are the back greater cornu, which is the greater horn. Really, cornu means horn. And then the lesser is here on both sides. This is greater, this is lesser. This is lesser cornu, this is greater cornu on both sides. But don't forget, this is the hyoid bone. I might just put an articulated skeleton looking from the side, so you have to know what the hyoid bone is. That's an easy one, and a lot of people forget that. This is a fetal skull. So, you're basically, you know the story, right, Rajun? On a Friday night, the sperm meets the egg and the fallopian tube, and then it implants in the endometrium and becomes a zygote. So the first 8 weeks is embryo. Then after 8 weeks, it becomes a fetus. So you hang around as a fetus from like that 9th week to like another 32 weeks till you're born. So you need a lot of flexibility in the skull as your brain is developing, because this is when your brain develops as a fetus and shortly after that. So these sutures are not fused. They're not fibrous joints. They actually have openings. So this is the right lateral view, and you can see that soft spot, that there's no connection to the bones, and has a pulse of its own. Like you could feel the blood pulsing if you feel that soft spot, like a fountain. So the front area is called the anterior fontanelle, and then there's a posterior fontanelle, and then there's a mastoid fontanelle, because remember the mastoid comes off of the temporal bone later, and then the sphenoid fontanelle. So in the superior view, which is probably the view I'll show you on the test, notice that the front is tapered, a little more narrow. The back posterior is wider. So this, I'll put an X there, and you're going to say anterior fontanelle of the fetal skull. This is posterior fontanelle of the fetal skull. Notice the mandible is shorter, right?
Can I ask a question? Sorry.
Sure, no problem, anytime.
What tissue is that?
So it's mostly cartilage, right? Because your bones basically are from mesenchyme, which is hyaline cartilage mostly. But your flat bones, they're intramembranous ossification, so it's mostly cartilage, chondrocytes, laying down cartilage, because cartilage always comes before bone, right? It's connective tissue.
Yeah, thank you.
Yeah, no problem. Which is connective tissue, mostly collagen. So it's protective, but it's soft and flexible because, again, like when you come out of that birth canal, right? This has to be really flexible to get out of there, out of the cervix, then out of the vagina, through the pubic area. So this has to be flexibility as well. And then they'll fuse later after a few months, right? I won't ask you that. This test is all going to be practical. There won't be any real written questions. So then the vertebral column. Any questions so far? How are we doing? Take a little break. So the vertebral column, let me stay in here. So the slideshow was kind of confining. So you're looking at two different views. So right away, get that down, because you're going to see other like articulated skeleton when everything is put together. So this is anterior view here, and you can see there's 7 cervical vertebrae, and you count down 1, 2, 3, 4, 5, 6, 7 anterior. And here's your lateral view, your right lateral view. So one of the ways you tell what you're looking at is these spinous processes are all posterior. And from C2 all the way down to L5, you have the spinous process posterior. The front is vertebral bodies, which I'll show you. So the second group of vertebrae down is the thoracic vertebrae, and there's 12. And both sides of the thoracic vertebrae have ribs attached to them. So there's 12 thoracic vertebrae, and there's 12 ribs on each side. So 12 pairs of ribs, 24 total. And then below the thoracic, you have no more ribs. You have what's called the lumbar spine, always counting down. So there's no ribs attached to these. These front parts are called the vertebral bodies, anterior. And in between, you have the intervertebral disc, the fibrocartilage he told me on the practical. And then you have the sacrum, which is technically 5 parts, all fused though. Sacrum is like triangular bone. And then the bottom is the tailbone, 2 separate bones, but they're fused. And you have the coccyx bone, which is like 4 fused segments. So it's about 24 vertebrae total. So only 7 cervical vertebrae. And later on, you're going to see that there's 8 cervical nerves, but there's only 7 cervical vertebrae. And the top 2 are very irregular bones. They're all irregular bones, but these are special designed bones. So know the difference between the sacrum and the coccyx, because there's 2 separate bones. So this is the coccyx, your tailbone. Why we have that, I have no idea. And there's curvatures, like the cervical curve is more of an anterior curve. The thoracic curve is more posterior, and that could be exaggerated with things like osteoporosis, hunchback kind of thing, dowager's hump. And the lumbar curve is more anterior, and that could increase too. Like a lateral curve is like an anterior curve, like an S curve. Like if this is the sacrum here, and this is the coccyx, and then the lumbars are here. Sometimes there's a curve like this, and that's a scoliosis. So a curve here in the thoracic is called kyphosis, excess curve, kyphosis, and it says that later in the PowerPoint. Sometimes if the lumbar curve is increased, they call that a lordosis or sway back. So there's some slides in here to help you with those clinical terms, but you have enough to worry about with the parts of these things. So in lecture, we talk about that a bit, but it's important to see it here in lab as well. So what I showed you before is the primary curves. And this is the exaggerated thoracic curve would be that hunchback kyphosis. Excess lumbar curve anterior. So this is posterior curve. This is anterior. Scoliosis is a lateral curve that you can see from the anterior. So here's the parts. You'll see your checklist, and I'll go through them all with you. Probably more than you need, but at least you get an idea. So let me go back to the slideshow. So this is a superior view of a vertebrae. Now this happens to be thoracic vertebrae, and I'll tell you why. Might as well get into that now. Remember, it's superior view. And it's only one, so we call it a vertebrae. Vertebra would be plural. So here's anterior, anterior. Here's posterior. So the things that jump out to me is one, you have one hole in these. You're going to see in the cervical vertebrae, there's 3 holes. But superior view, though. So the hole is going to house part of the spinal cord. So that's the vertebral foramen. And the front part is the vertebral body, or centrum. Sometimes it's called centrum. And that's the thickest part of the vertebrae, all of this. And the intervertebral disc will be on top of that or below that. Intervertebral means inter means between vertebrae. And here's a term you need to know. All vertebrae have a superior and inferior articulating process or articulating facet. Facet is the surface of an articulation of the bone. So we have superior on both sides. Now, I know this is thoracic because I see this. I see costal facets or demifacets here. And these are, and you just call them facets for costal articulations. That's how I know this is thoracic, because the thoracic have ribs attached, and costal means rib. So you'll see that the rib tubercle it kind of comes around, the rib comes around this way, and then attaches here. Like the head of the rib will attach to the costal facet on the body, and the tubercle of the rib will articulate on this part right here. And these parts, the lateral projections from each vertebrae, and pretty much every vertebra has this, is called the transverse processes, TP. So you have the TPs. Now here's the other obvious part, and this is only posterior. You have one spinous process. And every vertebrae, except for the atlas, does not have a spinous process. The atlas is the first cervical vertebrae, which makes sense because it means the top of atlas. But this is a thoracic vertebra, typical thoracic vertebrae. And they're all basically the same in the thoracic spinal column. So the connection between the transverse process and the spinous process is the lamina. The connection between the transverse process and the body is called pedicle. So pedicle is anterior, lamina is posterior. Just the connection. This is the lamina on the, and if you're looking at this is the patient's right side, and this would be the left. So get your point of view first and foremost, even if it takes a while. And the pedicle would be here, the right pedicle. So that's a typical vertebra. It happens to be thoracic, though. So this is a posterior view on top. So you see what comes out at you is you see the spinal process, spinous processes. This one happens to be lumbar. Still one hole. And here's your transverse process, your TP. And you can see a piece of the intervertebral disc from the side. And you can see the lamina and the articular processes, or facets if you like. Inferior for L4, these are the inferior articulating processes of L4. This is the superior articulating facets or processes. The facets are on the process. Process is an extension off of a bone. So you have superior articulating facets and inferior. And on the practical, just say articulating process or articulating facet, and you'll be good. Because sometimes it's not so clear in the picture because it's kind of unfair because you don't get to pick the bones up and move them around, turn them upside down. So you see what you see is what you get, and that's just a picture in a two-dimensional view, which is not really fair. So the question has to be fair. You're able to see what's on the picture. Very helpful though in the APR. So this is a lateral view, and this happens to be the lumbar spine. Remember, you always count them down, like L1, L2, L3. They're showing you just that section, not they're going to show you the whole lumbar spine. So a foramen is formed between the two vertebrae, like between L1 and L2, you have this intervertebral foramen. So get that confused with the vertebral foramen. Yeah, and there's the intervertebral disc, which is mostly fibrocartilage surrounded by some hyaline cartilage. And it's a shock absorber and a pivot point for motion. And here's the bodies, very obvious on the lateral. Here's the spinous process. It's hard to see the transverse process because they're two-dimensionally, they're coming at you. So this would be a really good place to say, okay, here's the spinous process posterior, here's the vertebral bodies. So here's a typical parts of the cervical vertebrae. And now what do you notice? You notice you have 3 holes now. So the cervical vertebrae all have 3 holes. One is remember the vertebral foramen? Which all vertebrae have that. Cervical, lumbar, and thoracic. And then you have 2 transverse foramen, only in the cervical. So this is for a housing for the vertebral artery, which is only in the neck going to the brain. So the transverse foramen only in cervical. That's a rule that you can remember. So you can tell by looking at the superior view that that's a cervical vertebrae, and that's how it presented to you. And you can see the 3 holes. No other section has that, just cervical. And the spinous processes are kind of finned, like they call it bifid spinous, like a fin. You see that looks like a fish's tail. And that only happens in cervical. It's kind of a weird view, but you can see the spinous process is posterior. You can see the body thick. And transverse foramina, which is only in cervical. And it's just bluing out the cervical spine. So if you see that on Image Connect, I could ask, okay, what section of the vertebral column is that? And you say cervical. What view is that? Lateral. So the atlas is the top vertebrae, and this is the most irregular of all the vertebrae, and it does not have a spinous process. Number 1, no spinous process. The only vertebra that does not have a spinous process is the atlas. So you could say atlas on the test, or you could just say cervical 1 or C1, capital C and a 1. So you have to know what's anterior and posterior. So you don't have a vertebral body either. You have what's called an anterior tubercle, no vertebral body. The only one that has that, or does not have that. And it's replaced basically by the anterior tubercle. Now the posterior tubercle is posterior, of course, and there's no spinous process in the atlas. Cool. So this is the first vertebrae. So remember those occipital condyles, those little slippers that were on the bottom of the occipital bone adjacent to the foramen magnum? The occipital condyles are going to sit right into this facet, superior articulating facet of atlas, C1. It has transverse process. It has transverse foramen, just like every other cervical vertebrae, but no vertebral body, anterior tubercle. No spinous process, posterior tubercle. So it does form an arch. And the next vertebra down below it is going to be C2, and that's going to be called the axis, because the atlas is going to rotate around the axis. So this is C2. And know what anterior and posterior is. Now the thing that stands out the most is this anterior superior process called the dens, sometimes called the odontoid process. Odontoid. So let's see what it says in your book. Same thing though. Only seen in C2. So basically the anterior tubercle is going to be in front of the of the atlas will sit on top of this and rotate and glide. So the superior articulating facets of axis will articulate with the inferior articular facets of atlas. C1. Transverse foramen again, 3 holes like every other cervical vertebrae. This is the vertebral foramen and the 2 transverse foramen housing the vertebral artery. Arteries are vessels that take blood away from the heart. And in this case, it's oxygenated blood going to the brain. So that's vertebral artery, and this is where the spinal cord is, in the vertebral foramen. Notice the bifid spinous process, only in cervical. Same parts like your lamina and there's a pedicle in the front, right? So very atypical, very irregular, the atlas and the axis. So know them if you saw them on a picture. So here's the joint, the atlantoaxial articulation. So C1 and C2 on top of each other. So you can see the anterior tubercle is anterior to the dens and has a rotation and gliding. And your articulating facets, this is atlas, so this is going to articulate with the occipital condyles of the skull. Transverse process, TPs, transverse foramen, C1, and this is C2. You can see how it sits on top. Bifid spinous. Transverse processes are small, but they're there, and they have foramen. 3 holes, remember? Only in cervical. The most prominent one is the bottom cervical vertebra, C7. It's the longest. So you could bring your hands down the back of your neck, and the first spinous process you feel is usually the vertebral prominence. And it's usually 90% of the time is the spinous process of the 7 cervical vertebrae. So if you can do any hands-on work in your career, it's good to find these bony landmarks and start having your fingers be sensitized to that, to where they are. If you're doing an examination or you need to do an injection or take an x-ray or do something where you know the bony landmarks. That's a good one. And there are many others. Thoracic are 12 and they all articulate with ribs. So this is a typical thoracic vertebrae. First thing you notice, of course, the anterior body, centrum. Only 1 hole, vertebral foramen. Spinous process posterior, transverse process lateral, right and left lateral. So this is the right side. If we're looking at the superior view, which we are, right, and this is left. I wouldn't really ask you that. So I just need you to know that this is a vertebra. Where's the body? Where's the transverse process? Where's the vertebral foramen? Is it cervical? No. Is it thoracic? You don't know from this picture. You'd really have to have a close-up to see those facets for the costal articulations. Rib, right? Costal means rib. So from the side, I get a little more information. This is the lateral view here. So I could see that there's a spinous process. And if you notice, the spinous process tends to point inferiorly, because in the thoracic spine, the spinous process kind of overlap. So they come downward. So if you look at them from the back, they kind of look like an elephant because of the long spinous process descending downward. So here's the body. Here's a costal facet for the head of the rib. Here's a costal facet for the tubercle of the rib. And technically, the vertebral body is a little more round than lumbar, but I really don't see it in this picture. So it's very difficult to tell the difference sometimes. Now, this is a lumbar, which generally has a thicker vertebral body anterior. Same, usually a triangular looking vertebral foramen. Basically the same transverse process, except there's no articulations for ribs. There's no costal facets. Then you have articulating process. This is superior, which I wouldn't ask you, but these are articulating facets here, superior or inferior, depends on what you're looking at. And this is posterior spinous process. Now, if you look at the lateral, you have the spinous process posterior, which is more vertical, right? They come out more vertical, or I should say horizontal, sorry. Horizontal, where these are more vertical in the thoracic spinous process. So if you look at it from the side, that looks more like a moose. If you look at it from the back, it looks like a giraffe. So you could tell, though, this is superior articulating facets. This is the body. You don't see the discs. You just see the bony part, the body of the vertebrae, which is anterior. So lumbar, thoracic, and cervical. Be able to tell the difference between those three as best you can. And I'll make it as obvious. So practice that in APR. Practice that with the models. Sacrum, again, doesn't include the coccyx sometimes. Sometimes you don't see the coccyx. So it's all fused parts. And I'll go through the parts with you. So this is, and this is what you need to know for sacrum. Not a lot. This is your anterior sacrum. This is your posterior sacrum. Number one. First thing, make sure you know that. This is the coccyx, not the sacrum, right? There's foramen, and these are called your anterior sacral foramen. Right? The promontory is the top of the sacrum, which is also known as the base. So I don't care if you say base or promontory, it's all good. But these have to be called the superior articulating facets, because what vertebra is going to sit on top of this? It's going to be L5 vertebrae, right? L5. And there's a disc between the sacrum and L5. So this is L5 sits right on top of there. Transverse ridges I probably won't ask you, but you should know what they look like, and you should be able to tell the difference between anterior and posterior sacrum. Now, ala usually means like ear-like projections. And there's going to be another bone that this is going to articulate with. It's going to be called the ilium. So the connection between the sacrum and the ilium is called the sacroiliac joint. It's not very movable, but it has some movement. So sometimes they call the area of articulation between the sacrum and the ilium, and it's on both the sacrum and the ilium. They call that the auricular surface. That's another word for ear-like. So you're going to see that both on the ilium and the sacrum, because it makes up the sacroiliac joint. So this would be like the auricular surface. This is the superior articulating facets. Posterior sacrum, now you have the posterior sacral foramina. Foramina is plural for foramen. But if I just point to one of these, you just say posterior sacral foramen. If I point to all of them, it's posterior sacral foramina with an A at the end. Hiatus is just an opening. Like sacral hiatus is where these nerves are going to come out, both sides. It's from the spinal cord, the very, very bottom, after it branches. And the middle, you don't really call these spinous process. So collectively, they're called the median sacral crest. And remember, that's posterior. That's really what helps me remember which is the posterior part of the sacrum, because it has the crest. You don't see the crest here. You just see the anterior and the transverse ridges. Anterior, what could have been bodies, but they're fused. They're not. There's no discs within the sacral section. The discs are between everywhere else, except for atlas and axis. There's no intervertebral disc between C1 and C2 either. But there is a disc between L5 and S1, which is the first sacral segment. And the coccyx, make sure you can name the coccyx. So here's the thoracic basket, or the thoracic cage, which has multiple parts. And you can see what we know already, right? You can see, here's the 11th thoracic vertebrae. Here's the 12th thoracic vertebrae. Here's the first lumbar vertebrae. And they all have discs, intervertebral discs. So let's look at the sternum. So the sternum is a rib attachment. This would be the first rib right here. First rib. There's 12 ribs on each side. The sternum has three parts that you need to know. The top part looks like a knot of a tie. And this is a word you got to remember, manubrium. Manubrium. That's the top part, manubrium. Then there's a separation between the manubrium and the next part, and that's called sternal angle. That's that little connection. It's kind of like a suture. Yeah, if you want to say suture, don't say suture, say sternal angle. And all of this is the body of sternum. The body of sternum. And then the bottom, this is a cool word, I always put this on, is a kind of a flexible inferior part of the sternum, and that's called the xiphoid process. See the spelling? X-I-F, I'm sorry, X-I-P-H-O-I-D, xiphoid process. So there's three main parts of the sternum, bone parts. Then you have a notch on top. It doesn't tell you here, but a notch is just a space where something's going to fit into. So the top of the sternum, you have what's called the jugular notch. Okay, and then the clavicle is going to articulate with the sternum laterally, and you have two clavicular notches. Don't worry about the costal notch. So if you notice now, all this, it's white here, but a lot of models and pictures, sometimes it comes out different colors, but it's white here. All this white is your hyaline cartilage, but you're going to call it costal cartilage. Costal cartilage, which is hyaline cartilage. So here's what you need to know about how they connect. So the first 7 ribs connect directly to the sternum via a little bit of cartilage. So we call those true ribs. So ribs 1 through 7 on both sides are termed true ribs because they have direct articulations with the sternum. Now ribs 8 through 12 only articulate with the costal cartilage, so they're called false ribs. The last 2, ribs 11 and 12 on both sides, are not connected to anything, so they're called floating ribs. So take a look at them in APR. We'll do a review, and I'll go through some models with you before this practically. I have to do a review with you. Okay. So if you said, like, if I pointed to this rib right here, and you said false rib or rib 12, you'd be correct. You don't have to put floating rib, but if you said floating rib, 100% correct. 100% correct if you said floating rib. So know the difference between true and false ribs and how the floating ribs are part of false ribs. They just have no articulations whatsoever. Crazy, I tell you. Here's the ribs now, the ribs. Again, this is anterior, the bodies of the thoracic vertebrae, because the ribs only articulate with the thoracic vertebrae. So first of all, you have to know this is a rib. Like if I put this on the picture, this is a rib. You know, later on when you see some other bones, like appendicular bones, sometimes it's not so obvious. So be careful with that. It's an easy question, really. So the rib has a shaft, and then where it bends, where that hairpin turn is, towards the posterior, that's the rib angle. It has a neck, which I won't ask you. But it has a head and a tubercle. That's important because the head of the rib is going to articulate with the vertebral body of the thoracic vertebrae. The tubercle is going to articulate with the transverse process, which is not shown that great here. So it's shown really good here. So this is important that you know the ribs. And within the rib, like you have to look inside the rib, you have what's called costal groove. And that's going to be an area of muscle attachment for muscles, like the intercostal muscles. Intercostal means between the ribs. Really important muscles of respiration, especially the external intercostals for inhalation, raising the thoracic cage, and internal intercostals for exhalation, depressing the thoracic cage. Sorry. So take a look at that. And I'm just going to go through the, actually we're done pretty much. I would like to just show you one thing though before we're finished. We're going to do all this next week because these technically aren't part of the axial skeleton, but I just want to show you the pelvis and the parts, just so you have an idea. Like you can see the sacrum here, and then you have 2 bones, like actually they're all fused together. There's 3 bones within one side. So this is called the os coxa, like your left os coxa, your right os coxa, and that has 3 bones. One called the ilium, one called the pubic bone, and then the ischium is posterior. And they're connected anteriorly through the pubic symphysis. And there's a pubic angle. Like if this is like an upside down C, the pubic angle, I call it the pubic arch. This looks like an upside down C, like this. That's more female. Females have more of an upside down C, where males are just more acute, like an upside down V of the pubic arch or subpubic angle. And that would be more male. So also I need you to look at this. The acetabulum is the socket for the ball and socket joint of the femur and os coxia joint, the hip joint, coxal joint. So acetabulum is the articular surface for the femur head. These are holes called the obturator foramen. So you're gonna have to know, we'll do this next week, but you should have to know the parts of the ilium. And then the parts of the well, not many parts, but the pubic bone and then the ischium. So that's really important. Just wanted to show you that, so you see where that articulation is.